We're trying to make Aboriginal health everyone's business. That's the motto. We absolutely want to just increase Aboriginal faces in our organisation, make it as safe and as culturally sensitive as possible for our consumers who are coming in. My name's James Blewett. I'm an Aboriginal project officer. I work in the workforce space. I'm a physiotherapist by background, and I come from Port Lincoln down on the Eyre Peninsula for Eyre and Far North Local Health Network. For me, there wasn't exactly anything to be able to stay and study based over in Port Lincoln, so I needed to move away to do my physiotherapy degree. For my last year, while I was still studying, I went up to Alice Springs and worked in their adult allied Aboriginal health team. And then I went over to Africa and worked in an African hospital. That's when I really realised that Aboriginal and minority health was actually something that I was really, really passionate about, which is why I came back to that SA health area and workforce. When I was in the Alice Springs hospitals, you see Aboriginal faces throughout the whole hospital. It's an awesome sort of sight to see, and you see Aboriginal consumers or Aboriginal people who are coming in. They look so much more comfortable. They enjoy going into the hospital if they have to, which is obviously not a nice area to be going into. And that's something that I thought, you know what, that needs to be down here. That needs to be Port Lincoln, Ceduna, Kurupedi and these hospitals over here. So my role is all around making that hospital atmosphere down here, and I think we've been able to do that pretty well. We've now got almost 60 employees, which make up almost 5% of our workforce, which is over and above the SA Health benchmark. Pathways to health is certainly an area that is where I have my passion. I was one of those people who had to go through, move away to study, come back. I'd work in an area where there's these Aboriginal professionals who have all had to move away from home, all had to leave family behind. That's what I want to sort of try and change and make it easier for people to be able to do that. Whether they're staying at home on country to be able to study, or whether they have to, still go away, but trying to make sure that those supports that make sure that they can succeed are there. We've got lots of young Aboriginal women in the organisation. I'd love to have more Aboriginal males as well, but the Aboriginal ladies that are all through the rooms here are great young leaders for our organisation. They're community members. They love sort of moving apart the community, going into different areas. They're professionals. They've got backgrounds. They've all done lots of different things, as I have in health, and we certainly lean on each other for support, lean on each other for help. Yeah, we're super lucky down here, that's for sure. We walk through and we see cultural training happening every day. We sit on interview panels where people are answering questions which directly involve Aboriginal culture, and they're answering it with more and more confidence because they're working alongside Aboriginal people and are quite comfortable working alongside our Aboriginal staff. And I think that change is certainly evident since I've been here, and I'm sure some of the other organisations are starting to see it as well. We hear it all the time, the preferred employer for our community. We hear it when we go down the streets, when we go to organisations, when we go to the community, that people are actually starting to call us and starting to message us and seek employment in this organisation, because it's starting to become the preferred employment for our communities, which is great.